All right. Welcome. Today we're going to be talking about 7 different traps concerning conversations with patients, essentially, and how we do examinations. Again, just an introduction. I'm Scott Cairns. The reason I do this, I help dentists, is to enhance the lives and livelihoods of all the general dentists who choose to work with me so that they may best serve their patients and themselves. So the first trap, we'll get right into it. There's 7 here. The assessment trap. So dentists jump in, assess, and give a solution. This is a behavioral disaster. So this is according to Dr. Lynn Carlisle. So all of these traps are highlighted in his Motivational Interviewing in Dentistry book, helping people become healthier. So definitely want to give him credit for coming up with all of this content. I'm just presenting it. So there's the assessment trap. So this is kind of classic dentistry where we are experts, they aren't, and we look at their mouth, we come up with a plan, and we give them our plan. Don't do that. There's the expert trap. So this is also how we're trained as dentists. We review their chart. We ask clinical questions. How long has this been going on? Does this hurt? Do you feel cold? Does this feel hot? Whatever. Doctor does an exam. He makes a diagnosis. He gives their diagnosis and a treatment plan. And then the doctor asks if they have any questions. Another thing not to do. All of these things are things pretty much not to do. All right, the treatment plan trap, right? So doctor falls in love with their idea, right? So doctor makes a plan independent of the patient's wants and understanding. It lacks collaboration. It lacks understanding. It violates the slow is fast principle. And it creates a sense of being overwhelmed, defeated, and lost, right? So something is happening to you, not for you, right? So to you, not for you. Treatment plan trap. Treatment plans need to be collaborative experiences for the patients. They can't just be something that's thrust upon a patient. And doctors have a hard time with that because they are the expert. They know what will work and what will work best. But it is not for us to make that decision without them being informed and having a choice and a say in how we're going to go forward with things. The next trap is called the premature focus trap. So the doctor discovers what without verifying the why, right? So, a tooth breaks and we just jump right in with a solution. Okay, your tooth broke. I can put a crown on that tooth and it'll be fine. You have decay into that tooth that goes into the nerve. It needs to have a root canal, whatever it is. All of a sudden, we're really focused. Again, this is very similar to the treatment plan trap, but we haven't really done our due diligence to see where the patient is and what they want to get out of this whole situation. Next is the labeling trap. So the doctor, the staff judges patients. Doctor, staff, oh, that person couldn't afford that. That person definitely wants to do everything because just look at their, what they're wearing. They really care about their mouth. So we project our beliefs on what we see about them onto their actual values without actually understanding what their values are. Doctor staff groups patients with others who have had a similar presentation or group of issues. So just be careful of that. You don't want to do that. There's the blaming trap. The doctor or staff blames the patient for the condition or their level of compliance and engagement. Results in a defensive. Patients aren't dumb, right? They figure this out. They don't want to be judged because of decisions that they may have or may not have made, or that they felt like they were in a hopeless situation and they had to make a choice that maybe they regret. So be very careful of blaming the patient for the situation that they find themselves in. Fresh starts with everybody, right? No judgment. And then this is huge trap. Probably it seems innocuous. It doesn't seem as bad as all the rest, but it totally derails conversations about helping people. And that's the chat trap, right? So the focus becomes small talk. It's too heavy on rapport. instead of health and or their lack thereof. If you stay in small chat and small talk, any chance you have of having a meaningful conversation is lost. So, and I think it's comfortable for people, and people were able to chat and have small talk with people well before they were dentists. So this is a very ingrained social expression. There needs to be rapport. Don't get me wrong. Rapport is essential. And I'll refer you to my preclinical conversation about developing rapport with patients. However, if the focus is small, then so will the relationship. It can't be superficial. People want to get better. That's why they choose to come see a dentist. They aren't going to the dentist to find a friend. They're going to the dentist to solve a problem. And our job is to solve their problems collaboratively with them. All right. Thanks.